Part 1 Section 1A PhilHealth Buhay Mahalaga, the medical basis bridging Filipinos to the new normal, protecting persons with comorbidities from common health issues and endemic COVID-19 by Rich Boone Camino, MD. From #MyPhilHealthW. The and welcomes, as the, and, as PhilHealth. As both agencies open another chapter, we extend our deepest gratitude to Dr. Jose Briggs Pujol for his dedicated service. We wish him strength and a full recovery as he now focuses on regaining his health. The President's marching orders are clear: promote wellness, prevent disease, strengthen primary care, and champion zero-balance billing for facility-based care, so that no Filipino family is forced to carry a burden it was never meant to bear. Together, DOH and PhilHealth will build on the gains already made and move toward a future where every Filipino family receives the care they need, when they need it, where no one has to choose between getting well and getting by, and where our people can trust that the health system will be there when it matters most. From oath taking of Secretary Beverly Lorraine Ho as new PhilHealth PCEO August 12, 2024. What are the objectives of PhilHealth Buhay Mahalaga? 1. Make healthcare delivery accessible to all Filipinos through all walks in life through integration of the PhilHealth Buhay Mahalaga with Yakap program of PhilHealth with use of a secure video chat. Communication or the private question on ward will be via video chat or telemedicine chat. 2. To be prepared to deal with upcoming infectious diseases which may again threaten the health, as well as the stability of the Philippine economy, such as diseases due to Ebola virus, hantavirus, etc. This is to prevent chaos by informing the public and social media. Three. Privacy of patients. 2. Will be protected. There will be no privacy issues because only the first and second are general informative questions asked to me, Dr. Rich, will be seen on the Facebook page. The third personal medical question which may be asked, which may entail the patient's personal health condition, will be through telemedicine chat or video chat secured by PhilHealth computers and technical group. An electronic full disclosure and privacy non-downloadable form will also be created. The form shall be thoroughly explained to the patient by another virtual group, the PhilHealth Privacy and Full Disclosure Group. Promote primary care and preventive medicine approach with the reconsolidation of screening tests for major preventable diseases such as uncontrolled diabetes mellitus, hypercholesterolemia, atherosclerotic heart disease, hypertension, stroke or cerebrovascular accident disease, etc., screening for malignancies such HPV tests, in cervical cancer, colorectal cancer, breast cancer, prostate cancer, childhood and adult immunization for over 60 years old, as well as catch-up immunization for the interruption especially during the recent COVID pandemic. 5. Integration with the Yakut, Yaman and Kalusugan program of PhilHealth, using social media with the privacy safeguards contained in this proposal.
U.S. and Israel launched a war against...
In December 2016, the future current Department of Health Secretary and former President and CEO of PhilHealth, Dr. Edwin Mercado, then a CEO and head of QualiMed, December 2016, reiterated the need to utilize primary care with the involvement of the private sector in the Philippine healthcare delivery picture.
And Mercado General Hospital. Thank you for being with us today, Dr. Mercado.
Thank you for having me, Rosa.
Let us start with the attractiveness of the healthcare market here in the Philippines for investment. So we've seen a lot of active growth in terms of mergers and acquisitions, yourself in partnership with Ayala, looking to expand the number of hospitals under the QualiMed brand, but also Metro Pacific on a buying spree, looking to acquire 12 hospitals by 2019. Vistaland also announcing plans to partner up with to enter the healthcare space through JVs. So let's look at what are the how attractive is the Philippine healthcare market, and also what are the drivers that will sustain its growth in the coming years.
It's looking like it's a crowded sector, but let's break it down into the segments that actually compose the whole ecosystem.
Right.
First, you look at the patient demographic, and then we will look at the payer and also look at the provider. For the patient, we all know we are 104 million population, mostly young. Our average age is 24 years old, so we are what we call in a demographic sweet spot. The employment rate is very high, but you look at the metrics, as you said earlier. The infant mortality rate and the maternal mortality rate is still very high. We missed on our Millennium Developmental Goals. We still have 38 births that are not attended. So really the opportunity is very high. The emerging disease is also shifting from before trauma and infection to more lifestyle diseases, which are chronic diseases.
Right.
Diabetes, hypertension, stroke. Also, the aging population is also an opportunity. We don't have yet a very solid network of nursing homes to provide elderly care and even end-of-life care. Now, looking at the provider, we're so underbedded. The bed population ratio here in the Philippines is only 1 to 10,000, which ideal is about 2 for our ASEAN peer and 5 if you base it on OECD rates. So just for us to maintain the 1 is to 10,000 bed ratio, we need to build 12,500 hospitals every year. Just to reach the ASEAN peer, you need to build 125,000. So imagine the underbedded capacity of the Philippines. Also, primary care provider is very thin, and I think that's what we need to focus on. In terms of the payer, you mentioned that our average GDP spend is now 4.7%. It's really a big growth from 2011 to 2014, about 31%. But still, the average spent per person.
The main thrust of PhilHealth in order to alleviate past administration's difficulty in healthcare delivery and coverage to feature primary care or preventive medicine. The old adage uttered by Benjamin Franklin exemplifies the importance of primary care or preventive medicine. An ounce of prevention is worth a pound of cure. Hence, the government will be able to save resources and cover healthcare needs to a greater number of sick individuals in the population. This will be the main thrust of PhilHealth Buhay Mahalaga.
And Mercado General Hospital. Thank you for being with us today.
Frequently asked questions. 1. Why is PhilHealth Buhay Mahalaga different from the usual telemedicine services? First, it is in social media so it can reach more Filipinos. There were 103,320,300 Facebook users in Philippines in January 2025, which accounted for 86% of its entire population. The majority of them were women, 52.6%. People aged 25 to 34 were the largest user group, 33 million. Source: Facebook users in Philippines, Napoleon Cat, Stats, website, January 2025. Truly the numbers are massive to entice Filipinos from all walks of life all over the Philippine archipelago. Two, it has a more personal touch as the patients online are empowered to ask two general questions and a more personal query which may involve his personal medical condition. It sounds too personal. Will the PhilHealth patient rights and privacy be encroached? The answer is no. We have the PhilHealth Privacy and Full Disclosure virtual group to let the patient sign a PhilHealth full disclosure form to ensure a person's rights are protected. Three, a more practical question: with poor internet connectivity in the Philippines, how can such a social media-based patient navigation system be fully functional? Answer: the proposal also includes plans for construction of PhilHealth BBM internet connectivity umbrella, which in essence are satellite internet connectivity tents with modems and routers. The satellite internet connectivity tents are located strategically first in the NCR to more remote rural areas. PhilHealth Bawat Buhay Mahalaga open chat forum will be the action method in which PhilHealth Bawat Buhay Mahalaga can collect PhilHealth patients from surfers in the social media, ask health questions and be assigned their own primary medical physicians from a pool of PhilHealth primary care patients. This will be explained in detail later. The current ransack of floods brought about by typhoons has caused a spike of waterborne diseases like leptospirosis and dengue diseases. We'll discuss later in greater detail. With increasing surge of leptospirosis and soon surge OFD dengue cases, initial task would be to find and coordinate what Filipinos need after the series of floods and typhoon of July 21, 2025. 2,300 Cas Chrising, international name, Witha, Dante, Francisco, Ademan, Come. At the moment, short-term goal: finding beds and treatment needed for leptospirosis and dengue. Long-term goal: establish primary care screening test to protect the Filipinos, most especially the high-risk group, elderly, sick with other diseases, obese, comorbid factors such as hypertension, diabetes, hypercholesterolemia, incomplete COVID and non-COVID immunizations, etc. PhilHealth Open Chat Forum will collect outpatient flood victim with primary care or ambulatory concerns.
Leptospirosis surge. DOA.
Preview of PhilHealth Bawat Buhay Mahalaga, the mission statement on health issued by His Excellency, President Bongbong Marcos during his first SONA, delivered at the Session Hall of the House of Representatives, Batasang Pambansa Complex, Quezon City on July 25, 2022.
Magtatayo tayo ng dagdag na mga health center at ospital. We must bring medical services to the people and not wait for them to come to our hospitals and healthcare centers. Napakinabangan natin ng husto ang malalaking specialty hospital gaya ng Heart Center, Lung Center, Children's Hospital at National Kidney and Transplant Institute. Kaya maliwanag na hindi lang dapat dito sa National Capital Region kundi maging sa ibang parte ng bansa. Bukod dito, upang mailapit natin ang healthcare system sa taong bayan nang hindi sila kailangang pumunta sa sentro ng kanilang bayan, lalawigan o region, ay maglalagay tayo ng mga clinic, mga RHU. Nang sa ganon, magiging mas madali sa may karamdaman na magpapagamot nang hindi na kailangan magbiyahe ng malayo. Magtatay
To answer this call by PBBM to make the Philippine healthcare system more accessible to all Filipinos from all walks of life, PhilHealth Buhay Mahalaga can bring healthcare services to the doorsteps of Filipinos from all walks of life and all corners of the archipelago, using the most used social media platform where Filipinos surf the web, Facebook. We can initially see the patient as the online medical social media-based navigation and healthcare delivery system. We can protect the ambulatory high-risk groups, the elderly, 65 years old and above, the obese, BMI, 30 and above, the pregnant women, persons with comorbidities, diabetes mellitus, hypertension as part of the metabolic syndrome, cardiovascular diseases, neurologic diseases and others. PhilHealth and DOH will protect the high-risk groups from long lines with no social distancing in registration. Time and effort will not be wasted. Excess mortality will be averted as preventive screening tests and consults for the disease pre-COVID that we have been working to prevent and treat will again be dealt with without fear of COVID, breast cancer, cancer of the GI tract, hypertension and cardiovascular diseases, stroke, dystonia, Parkinson's, movement disorders, dementia and other neurological diseases, etc. Since they only interact with ambulatory and N0 and emergency cases, I will immediately refer all emergency cases to National Patient Navigation and Referral System or DOH emergency physicians. Telemedicine consult is only intended for non-emergency cases. All emergency cases should be seen and treated in the ER face-to-face where all the available facilities and equipment.
In the Philippines face significant challenges,
PhilHealth
including a shortage of medical
is
professionals
complementary
and
to Elon
facilities.
Musk's Starlink
But
internet of
imagine
his
this.
SpaceX
With
satellites,
Starlink's
its
satellite
application in
internet-
medicine and surgery raises the standard to another level. It also complements the PhilHealth BBM internet connectivity umbrella in providing internet access for patients needing connectivity in PhilHealth BBM internet connectivity umbrella.
Significant challenges, including a shortage of medical professionals and facilities. But imagine this. With Starlink's satellite internet, telemedicine could revolutionize access to healthcare. Residents in remote regions could consult with doctors online, receive prescriptions, and access medical advice, all without traveling miles to the nearest clinic. Starlink could also empower healthcare providers to use advanced remote monitoring devices, keeping tabs on patients with chronic illnesses or elderly individuals. This means better, more personalized care, delivered right where it's needed. Plus, healthcare workers in these areas could tap into online medical training and education programs, improving the overall quality of care for underserved communities. Now, let's shift gears to e-commerce. Picture this, sellers in rural areas connecting with buyers nationwide.
I am Rich Boone Camino, MD, a graduate of Up College of Medicine under the Intern program, published author of I Yearn to Live and Not Merely to Exist. I am differently abled but enrolled like to be a part of nation building under the PBBM administration. I hope PhilHealth can approve my proposal. PhilHealth Buhay Mahalaga with the dawn of a new year 2026. I particular with migration of Aedes mosquito following humans for the after the holiday migration and festivities. Although the case fatality rate may be low, sick children and caring parents may disrupt the economy. Sick leaves by parents plus the presence of comorbidities increase the CFRs of hospitalized dengue by 3 to 17-fold compared with cases with no comorbidities. Source: mortality among hospitalized dengue patients with comorbidities in Mexico, Brazil, and Colombia and J. Troc MedHid.
ka ng 20,000 worth na libreng gamot. At madami kang clinic na pwedeng pagpilian. Malay mo merong malapit sa lugar nyo. Ito ay bagong programa ng government.
PhilHealth Buhay Mahalaga can be integrated to the Yakap program of PhilHealth. There will be two paths to enter the Yakap consultation with outpatient Yakap physicians. 1. Via face-to-face pathway wherein non-emergent patients can directly visit designated PhilHealth Yakap centers or by using EGovPH app. Then B. Designated Yakap centers nearest them and physically visit them. Or 2. Via Facebook social media-based physician-coordinated patient navigation system, PhilHealth Buhay Mahalaga. The patient then can fill the eGovPH app provided and submitted to the PhilHealth BBM front help desk and FB page, PhilHealth BBM.
Na makakatulong sa lahat ng PhilHealth members. Tuturuan ko kayo sa video na to kung paano kayo magpaparegister sa mga Yakap clinic na to gamit ang eGovPH app. Siyempre, meron tayong requirements. Una nga ay dapat PhilHealth member ka. Nandiyan sa loob ng eGovPH app mo, meron kang PhilHealth ID rin. Next naman, dapat naka-install na yung eGov app sa cellphone mo. At ito ay verified. Hindi pwede yung kakagawa lang ng eGov at naghihintay pa para ma-approve. Kung gusto niyo ng tutorial paano mag-install at mag-create ng account sa eGov, sundan niyo lang yung tutorial na to. Pindutin niyo yung lumabas dito sa taas ng screen. So kung meron na kayo lahat
natin ngayong umaga si Ginoong Raymond Bon. Ako ba? Ang Public Relations Officer ng PhilHealth upang pag-usapan kung ano ba ang tungkol dito sa Yakap program at mga benepisyong kalakip nito. Magandang umaga sa inyo, Sir Bon. Thank you very much for your time.
Yes, magandang umaga, Miss Annie, at magandang umaga rin po sa lahat po ng mga nanonood at nakikinig ngayong umagang ito dito po sa Hataw Balita.
Live and the RM the studio.
Yes.
Sir Mon, unahin ko na para marami tayong mapag-usapan tungkol dito sa Yakap program. Okay, ano yung pangunahing layunin ng Yakap program ng PhilHealth? Paano nito matutulungan yung mga miyembro, partikularmente yung may mga malulubhang sakit?
Okay. Unahin muna po natin, intindihan kung ano po yung programa po ng Universal Healthcare. Ang sabi kasi ng batas, na dapat every Filipino shall be granted immediate eligibility to promotive, preventive, curative, rehabilitative, palliative care. Alam natin, Miss Annie, na kadalasan, naalala lang yung PhilHealth kung kailan lang po sila nagkasakit, no? Or kung kailangan lang po sila ng ospital. At
natin ngayong umaga.
Last May 5, 2023, WHO Director Tedros Adhanom Ghebreyesus declared COVID is no longer a global emergency.
It's therefore with great hope that I declare COVID-19 over as a global health emergency.
The Director General of the World Health Organization on Friday announced he was ending the emergency he declared for COVID-19 more than 3 years ago, marking a major milestone in the pandemic that has killed more than 6.9 million.
If we are to enter the new normal, we have to include, or at least be given the opportunity to all Filipinos as one people. Persons with comorbidities and the vulnerable groups must be taken into account. Also, all aspects of the project will be adhering to the evidence-based system elucidated by PBBM. Perhaps the late African-American civil rights leader best describes our situation with COVID-19. Although it may now be declared no longer a pandemic, no one is free until we are all free. Martin Luther King, Jr. How can this work? 1. All potential patients enter through Facebook page PhilHealth Buhay Mahalaga. Why Facebook? 1. It is the most used social media platform in the Philippines, 94.78%. Source, Global Stats Counter 2. No word limit in text posts, unlike Instagram with 2,200 character limit. Source, Sprout Social. Twitter has only 280 character limit. FB is ideal for lengthy patient-doctor interactions. DOH Virtual Groups. Group 1 DO BBM Virtual Help Desk. Potential patients will be screened and processed into the DOH Free and Healthy Chat with Dr. Boom Camino. 2. DOH Virtual Group. Group 1 The DOH Free and Healthy Philippines Virtual Help Desk. Potential patients will be screened and processed into the DOH Free and Healthy Chat with Dr. Boom Camino. Virtual Group 2, PhilHealth BBM Privacy and Full Disclosure Virtual Group. A first task is to explain the patient of the privacy and full disclosure form via messenger and have the patient electronically sign the full disclosure form. B. Answer questions that the patient may ask. Reassure the patient that PhilHealth initiated this endeavor to make PhilHealth health service more accessible and safe amid the current COVID endemic variants and health issues of the patient. Providing a safe way to treat the high-risk groups and persons with health conditions seeking consult or treatment. DOH Virtual Groups. Group 1 DO BBM Virtual Help Desk. Potential patients will be screened and processed into the DOH Free and Healthy Chat with Dr. Let the PhilHealth BBM Open Chat Forum begin. The PhilHealth BBM Virtual Front Help Desk shall process the potential patient web surfers and present to Dr. Rich Boom Camino for the chat. Period. The PhilHealth BBM Open Chat Forum shall start with Dr. Rich B. The patients will ask 2 regular general theoretical medical questions, either the bread and butter health conditions such as hypertension, diabetes, sleep problems or COVID-19 questions. The PhilHealth DOH patient will then ask a more personal question in Messenger, private message which may involve his/her medical conditions. For this, the PhilHealth BBM Full Disclosure Virtual Group can provide a full disclosure and privacy similar to DOH hospitals for the patient to sign. After the PhilHealth BBM Open Chat Forum, the patient, with the help of the PhilHealth BBM Virtual Help Desk, will receive COVID-19 or booster shot and/or scheduled catch-up childhood vaccinations as ordered by the primary medical doctor and/or catch-up vaccination or boosters as needed. We must remember that vaccines are not a quick fix to attain immune protection from COVID-19. It usually takes 5 to 6 months with B-cell as antibody production, after which, the antibody production steadily declines but with adequate immune response. The patient's T-cell protection takes over. Dr. Rich, after answering the 3 questions on the FB page, shall present the cases to YACAP primary care physicians chosen by the patient from the list by PhilHealth BBM Front Help Desk. Primary care internal medicine, primary care, pediatrics, primary care OB, primary care psychiatry. These shall be PCP-PMD assigned to the patient. From this day forth, they shall manage and treat the patient. Patient will choose a PMD if without any MD from the list provided by the PhilHealth BBM Virtual Front Help Desk. The primary physician shall institute treatment and conduct screening preventive tests such as HPV test, pap smear, prostate exam, monitor blood tests such as PSA, cholesterol lipid profile, HbA1c, mammography, etc. After 3-4 months, may engage in face-to-face consult if cleared by primary MD. For patients with inborn or acquired immunodeficiency, the new PMD and infectious disease specialist may decide the measures needed, such as wearing an N95 mask or antiviral such as Paxlovid, etc. Hence, excess mortality from diversion of funds and medical attention away from regular illnesses such hypercholesterolemia, BPH, breast and prostate cancer, heart diseases may be prevented. Eventually, patient may be referred to specialists. Day 5. Begin constructing PhilHealth Buzz. Practice simulated chats with all virtual groups on Day 5 using a large process of constructing the connectivity umbrella. For low-income Filipinos unable to go online. Since it is an open tent, there would be adequate ventilation to prevent airborne Omicron BA5BQ1, BQ1.1, XBB 1.5, BF7, XBB 1.16 Arcturus, and other future subvariants from infecting the participants. There be an internet connectivity device such as a router and modems providing internet access to Filipinos without internet connectivity. The tent will have desks, 2 separated by at least 6 feet apart. This tent may accommodate 10 to 20. Participants may also have internet connectivity devices such as smartphones.
This team is absolute cheeks, man.
To decrease or eliminate excess mortality, PhilHealth Buhay Mahalaga we encourage physicians to conduct screening tests. Screening for prediabetes and type 2 diabetes. Conclusions and recommendation. The USPSTF recommends screening for prediabetes and type 2 diabetes in adults aged 35 to 70 years who have overweight or obesity. Clinicians should offer or refer patients with prediabetes to effective preventive interventions. B. Recommendation: screening tests. Prediabetes and type 2 diabetes can be detected by measuring fasting plasma glucose or HbA1c level, or with an oral glucose tolerance test. A fasting plasma glucose level of 126 mg/dL, 6.99 mol mg/dL, 11.1 mol/L, or greater are consistent with the diagnosis of type 2 diabetes. A fasting plasma glucose level of 100 to 125 mg/dL, 5.55 to 6.94 mol/L, an HbA1c level of 5.7% to 6.4%, or a 2-hour L, or greater, an HbA1c level of 6.5% or greater, or a 2-hour. Post-lobe glucose level of 200, post-lobe glucose level of 140 to 199 mg/dL, 7.77 to 11.04 mol/L, are consistent with prediabetes. One source, U.S. Preventive Services Task Force Recommendation Statement, August 24, 31. 2021 Screening for Prediabetes and Type 2 Diabetes. US Preventive Services Task Force Recommendation Statement, JAMA Network. Diagnostic criteria by American Diabetes Association. Diagnostic criteria by the American Diabetes Association, ADA, include the following: A. Fasting plasma glucose, FPG, level of 126 mg/dL, 7.0 mol/L, or higher, or a 2-hour plasma glucose level of 200 mg/dL, 11.1 mol/L, or higher during a 75g oral glucose tolerance test, OGTT, or a random plasma glucose of 200 mg/dL, 11.1 mol/L, or higher in a patient with classic symptoms of hyperglycemia or hyperglycemic crisis, whether a hemoglobin A1c, HbA1c, level of 6.5% or higher should be a primary diagnostic criterion, or an optional criterion remains a point of controversy. Indications for diabetes screening in asymptomatic adults includes the following: sustained blood pressure, 135/80 mmHg, overweight, and one or more other risk factors for diabetes, ed. first degree relative with diabetes, BP 140/90 mmHg or above, and HDL 35 mg/dL and or triglyceride level 250 mg/dL. The ADA recommends screening at age 35 years in the absence of the above criteria. Hypertension. Hypertension is defined as a systolic blood pressure, SBP, of 140 mm Hg or more, or a diastolic blood pressure, DBP, of 90 mm Hg or more, or taking antihypertensive medication. 5. Based on recommendations of the 7th report of the Joint National Committee on Prevention, Detection, Evaluation, and Treatment of High Blood Pressure, JNC7, the classification of BP for adults aged 18 years or older has been as follows. Normal, systolic lower than 120 millimeters Hg, diastolic lower than 80 millimeters Hg prehypertension, systolic 120-139 millimeters Hg, diastolic 80-89 millimeters Hg stage 1, systolic 140-159 millimeters Hg, diastolic 90-99 millimeters Hg stage 2, systolic 160 millimeters Hg or greater. Diastolic 100 millimeters Hg or greater. The classification above is based on the average of 2 or more readings taken at each of 2 or more visits after initial screening. Normal BP with respect to cardiovascular risk is less than 120/80 mmHg. However, unusually low readings should be evaluated for clinical significance. Three columns in the FB page. 1. Our nation's future starts now by PBBM. This inspirational journal will serve as a platform by the Office of the President to announce upcoming trips to seek more economic ventures with other nations. PBBM may post a YouTube video to speak to Filipino masses regarding the accomplishments and direction his administration is undertaking for the economy to flourish with COVID-19 still in background as we enter as a nation into the new normal with the ongoing issue of flood control project scandal. PBBM is graciously requested deliver a strong speech in YouTube and post the link here along with the written words to announce updates on the litigation of more arrested culprits. Updates on hiding accused fugitives like former Representative Zaldy Co and other high-profile personalities. PBBM may also deliver his direction on what PhilHealth can accomplish in his presidency to extend health coverage to more Filipinos from all walks in life. A bi-monthly message, along with a YouTube video, will be appreciated by the millions of Filipino PBBM followers. Hooping it right with Secretary of Health, Dr. Edwin Mercado. Hooping it right with Secretary of Health, Dr. Edwin Mercado, will announce updates about the still relevant pandemic COVID-19 and its impact on those with comorbidities, other health issues as hypertension, diabetes mellitus, tuberculosis, HIV and AIDS, etc., and other diseases. Yearly scheduled immunization for children under 6 years old, adult and those over 60 years old shall be discussed to lower post-COVID excess morbidity and mortality. Other health diseases such as hypertension, heart disease and DM shall now be the focus. The various projects or drives DOH has undertaken. An in-depth discussion of Secretary of Health Mercado's vision of one health system, one roadmap. Restoring trust through transparency and digital transformation. A YouTube video is also encouraged. This will be posted on this journal. The role of a joint cooperation of DOH and PhilHealth in healthcare delivery in 2026 and beyond shall also be discussed. All this is encouraged and to be also uploaded in a YouTube video with the contents posted here. Kindly note, others may view that it is important that DOH and PhilHealth have human caring personalities to stand out. I think that in the impersonal world of the internet, it is imperative to have a personal touch and not deliver merely a uniform message. It is important that there exist personalities such as PBBM, Secretary of Health, Dr. Edwin Mercado and PhilHealth CEO Beverly Lorraine Ho are not merely AI characters but real persons ready to touch the lives of everyday Filipinos. Also, the journals of DOH and PhilHealth are sports activities related to emphasize the value of physical exercise incorporated in our daily lives. This abides by the American Heart Association recommendation for adults. Get at least 150 minutes per week of moderate intensity aerobic activity or 75 minutes per week of vigorous aerobic activity, or a combination of both, preferably spread throughout the week. Add moderate to high intensity muscle strengthening activity, such as resistance or weights, on at least 2 days per week. Spend less time sitting. Even light intensity activity can offset some of the risks of being sedentary. And recommendation for kids. Children 3-5 years old should be physically active and have plenty of opportunities to move throughout the day. Kids 6-17 years old should get at least 60 minutes per day of moderate to vigorous intensity physical activity, mostly aerobic. Include vigorous intensity activity on at least 3 days per week. Include muscle and bone strengthening, weight-bearing activities on at least 3 days per week. Increase amount and intensity gradually over time. Source: American Heart Association recommendations for physical activity in adults and kids. American Heart Association website. Two. Hooping It Up with Dr. Edwin Mercado by PCEO of PhilHealth. Dr. Edwin Mercado, one of Dr. Edwin Mercado's favorite NBA player, claimed, "Talent wins games, but teamwork and intelligence win championships." Hence he molded PhilHealth to win championships in the heart of Filipinos by covering their various healthcare needs. Hooping It Up, Dr. Edwin Mercado will deliver a monthly report accomplishments of PhilHealth and benefits given. He will lay out future plans to ensure a sustainable national health insurance program for all. Three. Spiking an Ace with Dr. Beverly Ho. Spiking It Up with Dr. Beverly Ho is playful yet informative jab into primary care approach into healthcare delivery. As the president and CEO of PhilHealth, she will dwell into the screening tests and vaccinations of PhilHealth, the plans to invigorate the health system through the widening programs of Phil's Yakut program. Spiking an Ace with Dr. Beverly Ho will serve an ace, so to speak, which the information, as well as metaphorical charm, may be difficult for any volleyball blockers to oppose.